What's up everybody, Dr. Scott here with the Full Body Fix, and in conjunction with CrossFit Golden Gate, we're going to continue on in our CrossFit Prehab series, moving up the chain to the knee and hip this month. So what I like to do is equip you guys with a couple of ways to do some self-assessments to see how the knee and hip joint health is. So the first one with the knee is just going to actually be checking flexion and extension. And we can do this with a heel slide test to see if you can get your heel all the way back to your glutes almost. That would be full flexion. And for extension, what I'm going to do is prop the leg up at the heel onto something, contract the quad, and see if I can push the knee down into what's called terminal extension without any pain. If you do get some pain here, obviously get that checked out by a provider, but that might indicate that you need some work done there as well. A pretty common problem or limiting factor for especially a knee extension, but also this can translate up into the hip and low back as well, is tight hamstrings. This is called Bowstring Stretch. You're gonna lie on a flat surface, bring the hip into 90-degree extension, and then actively contract the quad to lengthen the hamstring. I'm gonna repeat that 10 times and do 2 or 3 sets. For knee flexion, you can modify the couch stretch, which is a pretty popular one, into a couple of different components. The common one is up against the wall. You're going to scooch that knee and foot back into the wall. I'll try to move off to the side so you can see it. And then work your way back into flexion of the knee. That'll stretch the quads and a little bit of the hip flexor that crosses the hip and the knee. We hold there for 5 or 10 seconds, let it come off, and then continue to try to get a little bit more mobility out of it. A variation I like a little bit more than the couch stretch for specifically quad and knee health is using a bench or a box, something kind of low that you can actually get into a bit of a, almost like a Bulgarian split squat, where you're getting into a lunge. I kind of like this because you can control the depth and range of motion a little bit more, a little bit more, I think more comfortable way to stretch that without necessarily focusing on the hip flexor in that position. But Dr. Scott with the Full Body Fix. We'll see you next time.